This is Mom, Dr. Primmer. I don't know, do I introduce you as Doc Prim?
You can do
Mom, Doc Prim, Dr. Primmer. Okay.
So I've wanted to make this video for my own female friends and the tons of other women experiencing androgenic hair loss. This is different than the autoimmune hair loss that I experience. Androgenic hair loss is actually the most common type of hair loss, except we usually only hear it in regards to men. For some women, hair loss might not bother them, and that's fine. But for many, it does, and they feel stuck in this situation. They've ruled out any other underlying possible medical conditions, and it really just comes down to their hair is thinning. Whether it's a small amount or a significant amount, it can be really stressful. And when looking this up, well, there's a lot of misinformation out there, and it can just be hard to talk about. So like I said, I wanted to make this video, and I wanted to specifically make this video with my mom. Because my mom is a dermatologist, recently retired. And in her many years of dermatology, she has helped hundreds and hundreds of patients with hair regrowth, including herself. So over the last week, when I went back to visit my parents, I sat down a few times with my mom to get some more info on this female hair loss topic that some might find interesting.
Okay, I can hardly see myself through there. So.
Is it okay though if you could kind of direct yourself there?
The majority of people who have hair loss have the kind of hair loss I have, which is called androgenic. They used to call it male pattern, but it also happens in
females, right?
Right. It's at the temple area and usually the back of the head. 50% of women, by the time they are 50, will have a significant amount of hair thinning. You sit in a movie theater and sit behind women, you will commonly see thin hair on the top of the head.
Can some women start noticing it in their early 30s?
Oh yeah, and some women even in their 20s and even in the teen years, although that's a very small percentage.
Got it. How about someone who's like in their early 30s?
That can be very common.
That's common? Okay.
Yeah. And many times it can manifest by a sudden loss of hair, like all of a sudden at one time of the year you see a lot of more hair on your brush and everything.
Right, or in the shower wall.
Doesn't always follow a pattern that if it's the mother, then you're going to get it. If it's the father.
Oh, really? That's not like an actual thing?
No.
Oh, interesting.
No,
Okay. It can, but not always.
Right. Just one gene that affects hair growth and the pattern of loss over your lifetime.
Got it.
Okay.
There are several effective treatments out there that often many people dismiss.
A lot of my friends think that if they do minoxidil and Rogaine, the amount that it will help may not be that significant.
Oh no, it's significant.
My mom was using several of these hair regrowth treatments, and years ago she stopped for a bit to see if it was really making a difference.
I stopped all this treatment. I also was using spironolactone, but I started using minoxidil first.
You stopped the treatments.
And then over the next 6 months, I started seeing I could see my scalp back here, and this got really thin back here.
So it was very noticeable.
Oh boy, yeah.
And like many things, patience is key.
How long would it take to see an improvement?
About 4 to 6 months.
4 to 6 months as well.
Yeah,
okay, so that's kind of like, there's not much that will go faster than that.
No. I mean, photography.
Yeah. Like filters.
Filters.
Yeah.
A major point my mom emphasizes to patients.
If you wait too long, as long as there's a follicle there and it has a blood supply and you're using minoxidil, you can awaken it, make it have its growth phase longer.
And a lot of people will wait
too long
until it's really bothering them.
Right,
and then by that time, you've waited too long.
Right.
It can feel kind of, why am I making such a fuss of it when it's not that bad yet? But actually, that's when you should jump on it.
Exactly.
For more details on the top 3 recommended treatments, check out part 2 of this video.
A long time ago, most people didn't live to be 80. By the time you had any significant hair loss, both men and women, you'd probably be dead and you wouldn't have to worry about it.
Cheery.